Hello and welcome to NHIA in a week where we give you the happenings in the authority and the scheme. My name is Shanice Palm. Now to our headlines. New CPC office for Tamale and renovation for Northern Regional Office. Free primary healthcare policy set to roll out in September. And salt curtain for new NHIS offices in Bono region. To our first story, the authority is set to build a brand new office for the Claims Processing Center in Tamale in the Northern Region, while the Northern Regional Office will also be given a facelift.
During a working visit to Tamale on July 23rd, Acting Chief Executive of NHIA, Dr. Victor Asaribampo, shared the good news with staff. He assured them that management recognizes their hard work and is committed to improving their working environment. He was joined by Acting Director of Claims, Dr. Abigail Dechi Kwatin Kujo, and Acting Corporate Affairs Director, Mr. Oswald Mensa. The Chief Executive took the opportunity to share his vision for fighting fraud, illegal charges, and loopholes within the scheme. He promised that HR and staff development benefits like training and capacity building programs will be accessible to all staff, not just those at head office. Northern Regional Director Mr. Al-Hassan Abdullahi welcomed the team warmly and briefed them on the region's performance. He appealed to the Chief Executive to engage health providers directly to help tackle illegal payments. The Corporate Affairs team also introduced the Pulpit Experience initiative that takes NHIA services directly to provider sites to educate and enhance visibility and member experience.
Ghanaians will soon enjoy free primary healthcare services. The nationwide rollout begins on September 1st and aims to ensure access to essential care for everyone, especially the vulnerable.
The announcement was made by NHI Senior Director of Special Initiatives, Dr. Anthony Gingon, at a high-level technical meeting in Accra. The session brought together key players from the Ministry of Health, Ghana Health Service, WHO, CHAG, HIFRA, NHIA, and development partners like R4D. NHIA Senior Technical Advisor, Dr. Chris Etim, emphasized the need for shared understanding around the core principles and structure of the policy, adding that chiefs level services will now be completely free. The technical advisor at the Ministry of Health, Dr. Kuku Awuno, added that the outcomes from this meeting would help shape a national blueprint.
Going forward, the outcome of this meeting is going to guide the technical committee to be able to come up with a blueprint. That blueprint will give us the pathway for which the free primary care will be implemented.
There was consensus around the need to prioritize preventive and promotive care, especially with the rise in non-communicable diseases. The Deputy Director General of the Ghana Health Service, Dr. Caroline Renouf Emisa, also stressed that while Ghana has made strides in curative care, more needs to be done in disease prevention and health promotion.
The Pharmaceutical Society of Ghana is advocating for licensed pharmacies to be part of the new free primary healthcare policy. They say pharmacies can help expand access and reduce pressure on hospitals.
Speaking at the meeting with NHIA and Ministry of Health officials, the Pharmaceutical Society of Ghana, Mr. Samuel Koldonko explained that community pharmacies have long served as the first point of care for many Ghanaians, especially for common illnesses. Deputy Executive Secretary Dr. Henry Amoini Notri called for pharmacist-led services to be covered under NHIS. He proposed bundled payment models to support services like hypertension reviews and medication therapy. Mr. Xavier Yevuche from the Ministry of Health acknowledged the value of pharmacies in healthcare delivery, but stressed the need for proper systems to support the integration. NHI's Dr. Anthony Gingon said all stakeholders, public and private, must be part of the conversation to ensure fairness in service delivery and reimbursement. Dr. Chris Atim welcomed the proposal and asked Pharmaceutical Society of Ghana to map out pharmacies ready to join. The meeting ended with a joint commitment to prioritize underserved areas and align the integration of pharmacies with the goals of the free primary healthcare policy.
Moving on, the NHIA Eastern Regional Director has been on the move, visiting several district offices to connect with staff and monitor service delivery.
Frank Addo, joined by Regional Operations Manager Daniel Fuseni, visited NHI district offices to interact directly with staff, monitor performance. He emphasized the importance of professionalism, good client service, and embracing NHI's digital transformation, especially around claims processing and timely card issuance. Conversations centered on community outreach membership, growth, and performance tracking. He encouraged district managers to run monthly performance reviews and create spaces for peer learning and innovation. On co-payment, Mr. Addo reminded staff of their role in gathering credible evidence to support national efforts in curbing illegal charges. He also called on staff to support the regional welfare scheme and make their well-being a priority. In meetings with NHI's members at registration points, he listened to feedback and reassured them of continuous service improvements.
To our final story, the NHIA has broken ground for the 2 new district offices in Brekum and Doma West. The move is part of efforts to expand access and improve service delivery in the Bono region.
Acting Bono Regional Director, Mr. Isaac Bedu Amponsa, led the sword cutting ceremonies on behalf of NHIA CEO, Dr. Victor Asari Bampo. The decision to build the new offices followed the CEO's earlier visit to the region, where he observed firsthand the challenges staff and clients face due to poor infrastructure. Mr. Amponsa reiterated NHI's key priorities, which are universal health coverage, prompt payment of claims, and support for the Mahama Care Social Protection Initiative. The Member of Parliament for Brekum East, Elder Simon Ampabing Treme, commended NHI leadership for finally addressing the area's long-standing infrastructure gap. He applauded the efforts of the MCE and Traditional Council in securing land and urged the contractor to deliver quality work. Doma West DCE, Mr. Stephen Asoba Awuni, also praised his MP's dedication to NHI's operations, including providing temporary office space and furniture. The ceremonies were well attended by traditional leaders, NHI staff, local authorities, MPs, and community members.
Let me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be pedroni boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith, eh? Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power of Ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
That's all that we have for you in this week's edition of NHIS in a Week. For more stories, do visit our website www.nhis.gov.gh or do visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.